we are the local management board for Kent County. There are 24 local management boards in Maryland. So we're a model, and Maryland actually leads the country in this model, where to better coordinate services, where you don't have everybody doing things for children and families in their separate little silos, you are very coordinated. And the way we do that is that the governor has a children's cabinet at the state level, and he has the Secretary of Social Services, Juvenile Services, Crime Control and Prevention, all of these agencies that in some way or another are serving families and children. They meet, they have a strategic plan, they set some priorities, they look at what are the most urgent issues around the state, and then they communicate that with their county affiliates. And what we do that's unique in Maryland, because there are some other states that have children's cabinets, but Maryland's the only state right now that has a children's cabinet in every county. And so I am staff to that board, that local children's cabinet. And so we have to have on our board the director of social services, somebody from the public school system, from the health department, juvenile services, our core service agency, which here is Midshore Behavioral Health. And then we also invite in residents, parents, folks who have lived experience with raising children or working with kids, nonprofits, et cetera. We all have our own board, and we then look at what we want to address locally in Kent County. And that way you have this really nice balance of not only is the state thinking strategically, but the local community is thinking strategically. What's most important to us? What do we want to accomplish? How do we want our community to serve children, to work with families, to provide services, and make sure that kids and families are being able to really thrive and come out of Kent County stronger and better for it. So that's kind of the model for how we operate. And then some of the technical aspects of that is that the governor has hopefully soon, this has kind of been taken apart, but we're putting it back together, a governor's office for children, and they're the ones that serve as that liaison between the state children's cabinet and the county cabinet. And there's funding that it comes with that, so we get an award every year, and we can use that to fund our priorities, some of the programs that we feel are not being addressed by other partners in the community, like an after-school program is a big priority. At the middle school, the school system doesn't necessarily have the resources to do that, so the local management board can step in and make that happen. The core component of that planning is the fact that we do have such a broad cross-sector of agencies and organizations and people with relevant experience putting those plans together. Historically, every 3 to 5 years, we do a deep dive into local data, demographics, like what's coming out of the school system, what are we seeing at the health department, and are we seeing any concerning trends there that we feel like we need to pivot and address. And then we'll usually work as a board and maybe with a consultant to look at what are the needs, what do we want to focus on, et cetera. We're trying to shift now to do a planning process that's much more strengths-based, and there's a lot of different models out there, but instead of just saying, what's the biggest problem and where's the greatest need, while those questions are important, we want to actually start in different communities and identify where there's opportunities, where there's strengths. And if we build around that, you're actually going to see much more innovative ideas. Because if you just start with, we need more houses. Yes, we know we need more houses, but what can we really do as a community, partnering with our local and state entities to start addressing those issues in ways that are creative and ways that might see some results in the short term as well. and get everyone involved. Like, you'll just see much more robust civic engagement and participation if you're really working from like the neighborhoods up. So we've been talking with Washington College, with the United Way, with folks on our board and in different communities of how can we start practicing some of these principles where we're working in communities and kind of building these cohorts of people who are invested in and building up ideas and then hopefully putting some resources behind that to help it take off. So I think that's what we'll be seeing more of in the coming year. An opportunity that came out from the state that we just really wanted to go after. So it's a grant from Department of Housing and Community Development, and it's part of the state's priority of getting more folks connected to internet. And so it's called the Connected Devices Grant. And we applied for 500 laptops that we will be able to give out to households who really need access to the internet. And sometimes, you know, you can have access to the internet on a phone or going to the library, but being able to have a laptop in a household that's connected to the internet can really be transformative, especially now that more and more services and resources are more accessible through that. You can have your telehealth appointments, you can do homework, you can do like all sorts of things if you're being able to actually have a laptop at home. I would say that we do two important things. One is we bring folks together, whether it's to talk about what our priorities are, where we want to invest the limited resources we have, and also bringing people together to just be connected, period, so that we're not each in our own lane without being aware of what other folks are doing or what's even out there. So on kentcounty.com, we have a family resource directory that actually lists all of the different local nonprofits or agencies or offices that have services to offer. The local management board doesn't actually, the state says that we're not allowed to provide direct services. So I'm not supposed to have folks come in here and provide counseling or, you know, do things directly as the LMB. We bring in all the folks who can do those things and make sure that they're getting connected to families. So we have the resource directory. We also have the local care team. And my coworker, Jamar Abner, is the coordinator for the local care team. And so what the local management board does kind of at that systems level, when we have a board meeting and everybody's sitting around the table and we're saying, oh, we really need to be filling this gap in the community, and this is what I'm seeing in my agency, what are other folks doing to help with that? The local care team does that with individual families. So the family comes to the meeting, they're usually experiencing some kind of challenge with their child, whether they need more mental health services or they're having behaviors or they don't know what else to do. All of those agencies with services and resources sit at the same table with the family and they problem solve and they come up with an action plan to put supports in place and help get that family back on track. That kind of coordination element, that's really important to what we do, and it's hard to describe because it's not necessarily tangible. It's a service, it's communication, it's relationships. And then the other component of what we do is that we do fund programming. So we have our own budget that's able to fund the programs that our board has decided are really important. So we have a community plan. Out of the community plan, we say, okay, here's some of the strategies to get to where we want to go regarding our priorities. So the funding for next year is pretty exciting. This year we had a program that was just planning, but we had a cohort of 30 high schoolers, and the high schoolers designed their own program of what they want to do to improve mental health. Because the board saw that mental health in the high school and middle school was really taking a sharp turn in a direction that we didn't like. And we know that there are different agencies that are able to provide counseling, like Choptank Community Health now has counseling. We have some great providers in the area. We have some social workers in the school. We have agencies that are going into the school to provide counseling. But we wanted to work with a group of teens to say, okay, what else can we do to help turn this around? And they are proposing kind of a cross-age peer mentoring program where upperclassmen will be able to do a lot of work to learn about how to support each other, about teen mental health, about trauma-informed practices, all of these different elements, and how can they then become mentors and almost like peer counselors to the incoming freshmen and eighth graders as well. They were really concerned about their younger peers.